Focusing Health TV, place where you're going to receive the best health tips on your body. As you're about to watch this video, like, subscribe, and share for everyone to see. Thank you for watching.
In today's video, I'm going to be using this diagram to fully explain most of the possible causes of you not getting pregnant yet. This video is for those of you that have been trying to get pregnant and it has been unsuccessful. In today's video, I'm going to be telling you all of the reasons or all of the common reasons why you have been trying so hard to conceive and it's been unsuccessful. And I am going to be telling you all of the tips and secrets on how you can overcome all of these challenges in order to get pregnant. If you are new to my channel, this is all I do. I talk about infertility and the treatments, the solutions, how you can help yourself when you should see a doctor. I am Dr. Amarachi Ijoma, so if this is the kind of content you are interested in, keep watching. So ladies and gentlemen, this is the uterus, and in today's video I'm going to be using this diagram to fully explain all the possible causes of, or most of the possible causes of infertility, most of the possible causes of you not getting pregnant yet. So this is the vagina. This is usually where the penis deposits sperm, just around this area. So this is the vagina. This is the cervix. So this whole area here is the neck of the womb. It's called the cervix. It's the neck of the uterus. This is usually where the baby comes out from. It's usually closed until labor. When the baby is about to come out, then it dilates. It opens up for the baby to come out. The baby passes through the cervix into the vagina and out into the environment, into your hands. So these are the ovaries, and the little circles you're seeing, the little dark circles you're seeing on the ovaries are called follicles. They are like sacs of fluid, sacs that contain water, like fluid-like substance that contains the egg. So on the ovaries, or rather in the sac of fluid, in the follicle, the egg is suspended in the fluid. And these red dots you're seeing here are the eggs. Then you have the fallopian tubes. These and these are your fallopian tubes. So this whole area you're seeing here is actually the uterus. Every other thing that I've mentioned right now are other organs that are connected to the uterus. And then we call this place the cavity of the uterus. This is usually where the baby lies. So now that I've brought you guys up to speed with what the uterus looks like, what your reproductive organs look like, now let's get down to business. For pregnancy to occur, a sperm must meet an egg. So fertilization will occur when this happens, and then a baby will be formed. So for this sperm and this egg to meet each other naturally, sexual intercourse must occur. So this is what happens when you have sex. The penis enters the vagina and then deposits the semen into the vagina. So these are sperm cells from the semen. Because what you actually see when a man ejaculates is actually called the semen. The semen is the fluid that you see when a man ejaculates. But inside that semen, there is sperm, but you can't see the sperm. The sperm makes up only 5% of the entire semen, and you cannot see it with your naked eye. So now, even though I said 5% of the entire semen, that 5% amounts to millions of sperm cells. And guess what? We only need one sperm cell to fertilize the egg. So the journey begins from here. Then they start to enter through the cervix into the uterine cavity. So these are the sperm cells still moving. It's usually like a race, but only one is going to get to the egg. It's usually the fastest one that will end up getting to the egg. For an egg to be released, ovulation has to occur, and ovulation is simply release of a mature egg from the ovary into the fallopian tube. So now in this case, this egg has been released. A follicle grew so big and then ruptured, and then the egg has been released. Then this is the fimbriae, like the hand of the fallopian tube, which will pick up the egg, and then the egg will migrate all the way to this place. And then wait for the fastest sperm to come and fertilize it. Then when this sperm gets to the egg, fertilization is said to occur. Now, when fertilization occurs, this becomes the zygote. Then it then takes about 5 to 6 days for the fertilized egg, which is the zygote, to actually journey into the uterine cavity, and then when it gets here, it implants. So implantation usually occurs inside the uterine cavity. So this is your implantation. So if fertilization is this straightforward, why are you not getting pregnant? There are several reasons that can prevent fertilization from occurring and hence prevent pregnancy from occurring. Let's start with the sperm. If the sperm is not able to do all of these things that I talked about, then it's never going to be able to meet the egg, and then fertilization would never occur. So what can cause the sperm to not be able to meet the egg? One, if a man has low sperm count. Sperm count is said to be normal when a man releases at least 20 million sperm cells per mil of a particular ejaculate. Some experts say when a man ejaculates at least 15 million sperm cells per mil of a particular ejaculate. But how do you know how many million sperm cells that you have ejaculated? That's easy. You have to do what we call a semen analysis. You go to the lab and then you produce your sperm via masturbation into a container, and then the lab scientist runs the test for you. Also, remember I said that it's like a race. Only the fastest sperm is going to fertilize the egg. So if the sperm cell is not fast enough, that is, if its motility is reduced, it can also prevent fertilization. Sperm has a particular shape, so if the shape of the sperm is distorted, then it could be a genetic or a DNA problem, and then it's going to also affect the chances of the sperm actually meeting the egg for fertilization to occur. So when you're not getting pregnant due to a problem with the sperm, there's actually solutions for it. First, you will need to find what is the cause of my sperm being abnormal. So I'm going to be mentioning some lifestyle habits that studies have shown that affects the sperm. We have smoking, excessive drinking, excessive weight gain, excessive weight loss, heat around the testes, and this could be gotten from placing your laptops directly on your thighs while working, or visiting the sauna very frequently. Sauna is an enclosed space where the temperature is set to be high for various reasons, but this sauna can actually affect your sperm production. Also, there are other causes like genetic abnormalities, DNA problems, even certain medications. For example, antidepressants. If you're on antidepressants, it can actually cause low sperm counts. So if you have been able to identify your lifestyle habits that can potentially affect your sperm production or sperm motility or sperm shape, then you have to try to address those causes. If it is the sauna that you visit frequently, or you're always in a jacuzzi, a hot jacuzzi, then you have to stop. And if you stop, you will notice that within 2 to 3 months, your sperm count will return to normal. It will increase again. And this is because it takes about 3 months for the sperm to be produced in the body. And also, research has shown that when men stop going to the sauna, or stop entering the hot jacuzzi, or stop putting their laptops directly on their thighs, within 3 months, the sperm count returns to normal or simply increases. There are also prenatal supplements for men. Yeah, it's not only women that take prenatal supplements. So some men take prenatal supplements, and these supplements help to actually increase the sperm count and help with the sperm health in general. But this is not absolute. So some men may use these supplements and it will help with their sperm health, and for others it wouldn't. So like I said, you need to visit a specialist to find out what the cause of your sperm abnormality is. So while shopping for that supplement, there are 2 important ingredients that you should look out for in a male prenatal vitamin, and they are zinc and CoQ10. Several studies have shown that CoQ10 helps to improve the movement of the sperm. That's the motility of the sperm cell, how fast your sperm can swim to get to the egg. And then for zinc, it's not just the movement that is improved, even the sperm count is improved. So if you want to know other ingredients to look out for in your male prenatal vitamins, I'm going to put the link to a video where I talked about male prenatal vitamins and all you should look out for in a male prenatal vitamin. So another reason you may not be getting pregnant is, as a woman, remember I said this is the neck of your uterus. This is where the baby comes out from, and it's usually closed until during labor. Also, it slightly opens during menstruation so that the blood coming from here can actually come out. On the cervix, some women have what we call a growth. This growth is called a polyp. And sometimes the growth is like this, big enough to block the cervix. Most times you don't have any symptom when you have a polyp, so it's usually during a routine vaginal examination that your gynecologist may just stumble upon it and be like, oh, you have a polyp. But for some women, they have excessive bleeding and long duration of bleeding. So it's important that I mention that polyp doesn't always cause infertility. It can sometimes cause infertility. And the treatment to this is simple. During that vaginal examination, when your gynecologist stumbles upon it or your healthcare provider stumbles upon it, what they do is they just do a minor procedure to take it out. If it is a smaller polyp, they'll just use a forceps to twist around the stalk and take it out. And then it's usually an outpatient procedure. You go home the same day and you're fine. So I know that my uterine cavity, where the baby is supposed to lie, I know that I have drawn it as this wide space. Yes, it's a space, but it's usually collapsed on itself. So imagine there is an injury or an inflammation in this cavity, and remember I said it's collapsed on itself. Then when it's healing, it will heal together and then fuse together. We call this adhesion. And one of the causes of uterine adhesion is untreated sexually transmitted infections. So again, you can prevent sexually transmitted infections simply by avoiding multiple sexual partners or using condoms. When you use condoms during sexual intercourse, you protect yourself. So your question may be, but the penis cannot get all the way into the uterine cavity. So how is the sexually transmitted infection causing injury to my uterine cavity? The explanation is, even though the penis stops here, once the infection starts from this area, your vagina. But one thing about sexually transmitted infection is that it can ascend. It will go through the cervix into the uterine cavity. Sometimes it even gets all the way to the fallopian tube. So it doesn't only cause injury and scarring in your uterine cavity, it also causes injury and scarring in your fallopian tube. And if this happens, sperm cannot get into the uterus, because remember, the scarring has caused it to heal on itself. So now this space that the sperm is supposed to go in through is now closed up due to the adhesions, due to the scarring, and then fertilization will not be able to occur. Because remember, the egg is usually here. When the egg is released from the ovary into the fallopian tube, it's usually here. So if the sperm cannot pass here because there is scarring and no space for it to pass, or let's just assume that the scarring didn't occur here but went all the way here, the injury here was so severe that the scarring occurred here, even if the sperm gets into the cavity, it wouldn't be able to pass into the fallopian tube and get to the egg, so pregnancy will not occur. So the treatment depends on the type of STI. So we have the bacterial STI, which is the chlamydia, the gonorrhea, the syphilis, and then we also have the viral STIs. So treatment depends on which it is. So again, you have to visit your healthcare provider so that you can be properly evaluated and the cause of the infertility is found. If it is a bacterial STI and your healthcare provider catches this early before any major damage is done, then treatment, once you do your complete course of antibiotics, you're good to go. You'll be completely healed and it shouldn't affect fertility. But if complications have already occurred, that is injury and scarring, you will still get treated with antibiotics to prevent further damage, but then you will still need your healthcare provider to perform a procedure that will help to open up the uterine cavity.